Good morning. Welcome to the lecture on Chapter 5, Health Law, Policy and Ethics. So these health law, policies and ethics provide a wide range of tools that society uses to encourage or discourage behaviors by individuals as well as groups. A law is a system of rules which a particular country or community recognizes as regulating the actions of its members, and it enforces these laws by the imposition of penalties. And health law is the area of law concerned with the health of individuals and population. It deals with the provision of health care and the operation of healthcare system. Some examples may be how we address non-communicable disease risk factors like smoking. You regulate smoking in certain areas. And what are policies? And policies are principles of action adopted or proposed by a government, party, business, or an individual. So these are created essentially by any organization, and the organization can enforce the policy it created. So the policies, these health policies are decisions that goes beyond the individual sphere and affects the greater community. So what are some examples of health policies? So examples of some health-related policies include policies that prohibit tobacco and alcohol use at workplace, or policies that requiring healthy foods to be served at community meetings and events, and workplace policies that allow time for exercise and to attend health programs. So these are health policies. This may be created by any organizations. Now we'll look into what is ethics. So ethics are moral principles that govern a person's behavior or their conduct of an activity. So bioethics, it includes elements of both healthcare and public health, and it focuses on applying morals or values to areas of potential conflict. For example, some ethics which are included in healthcare include the principles of autonomy, principles of fidelity, principles of justice, or beneficence, or non-maleficence, or some principles that are required when you do some research. So these are ethics, bioethics. Now let's go into detail of each. So the objectives include to explain the scope of health law, policy and ethics, identify key legal principles that form the basis for public health law, identify 4 types of law, discuss and illustrate the concept of health in all policies, explain the difference between market and social justice, illustrate the potential tensions between individual rights and the needs of society using public health examples, discuss key principles that underlie the ethics of human research, identify principles of public health ethics, and discuss policies aimed at preparing for and responding to pandemic disease. So what is the scope of health law, policy, and ethics? So as we said, these offers a wide range of tools that society uses. It helps to encourage or discourage certain behaviors. So these affects a full range of issues that confront us in population health. These address issues such as access to and quality and cost of healthcare. They address organizational and professional structures designed to deliver these healthcare. They address issues ranging from occupational safety to drug and highway safety, from control of communicable diseases to non-communicable diseases, environmental diseases, Further, bioethics attempts to apply individual and group values and morals to controversial issues such as new technologies, stem cell research, and end-of-life care. So the main components include healthcare, public health, and bioethics. The components include healthcare, public health, and bioethics. So what is the scope of healthcare? So in the healthcare component, we are looking at access, quality, and cost of healthcare. We are looking at how is the organizational structure, what is the professional structure of the healthcare delivery system, how is the public healthcare system, how is the private healthcare organizations working, how are non-governmental organizations working. And so there are some rules and regulations regarding healthcare. Some examples include rules regarding Medicare or Medicaid. How about private insurance? What is ACA? And also deals with hospital governance and the professional licensure. What is the licensure? What are the requirements to be a registered nurse or a social worker or a physician in a particular state? The licensure requirements vary from state to state. Moving on to public health. It deals with population health and safety. These include governmental efforts to provide services to entire populations, as well as vulnerable groups. Some issues include food and drug laws and procedures, environmental laws and procedures, regulations for control of communicable diseases. And what is bioethics? It is the application of individual and group values and morals to controversial issues. So we use certain principles of bioethics. So it deals with issues such as end-of-life care, stem cell research, use of new technologies, protection of research subjects. How do we select a person over another person for a research? So these are various components of health law, policy, and ethics. So we have healthcare, public health, and bioethics. So what are some legal principles that underlie public health and healthcare? First of all, the U.S. Constitution. U.S. Constitution is the fundamental document that governs the issues of public health and healthcare law. However, the U.S. Constitution does not mention health, and public health and healthcare are issues that are left primarily to the authority of the states. The states have some authority and they delegate these authority to local jurisdictions such as cities or counties. So states can use their authority to pass legislation and take actions to protect the common good. This power or authority is known as the police power. So this use of authority by the states are used for regulation of healthcare professionals and facilities, establishment of health and safety standards, control of hazards ranging from use of restraints to vaccinations. So one example where police power was enacted was a case called Boone versus Boozman. So in that case, a child who went to a public school in the state of Arkansas was asked to immunize herself before going back to the school. So she was suspended from the school because she had not received hepatitis B immunizations. So her mother, Cynthia Boone, she challenged in the Supreme Court in 1983 and states that they have the right to choose immunization or not. But the United States Supreme Court recognized that a state can require public and private school children to be immunized because when you are trying to protect against spreading of a disease in a society, the free exercise of religion and parental rights are subordinated to the society's interest. So that is what the Supreme Court said. Supreme Court said the state has the police power to enact that rule or having the child immunized before going back to school. But there are some other rights that we have or individuals have to protect their own health. So let's look at those rights now. So the US Constitution grants individual rights such as freedom of speech, religion, assembly, right to bear arms. So they have other rights such as right to privacy, right to bodily integrity, right to travel. And they have the right to utilize contraception, right to have an abortion. So these are individual rights. Now let's look at what is negative constitution. So the US Constitution allows governments to act to protect public health and to provide healthcare services, but does not require governments to act to protect public health or to provide healthcare services. This has been referred to as the negative constitution. So the governments have the authority to act, but they are not required to do so. For example, Supreme Court has not found an obligation on the part of the states to act to prevent child or spousal abuse, even when the state is fully aware of specific circumstances or a court has issued a restraining order. So that is known as negative constitution. Okay, and now let's look at types of laws. Now let's look into types of law. First is constitutional laws. The constitutional laws are like the constitutions by the US as well as the constitutions of 50 states. These constitutional law provide authority to states to exercise their power over individuals' rights. So that is known as the police power. Further, we saw that the federal government also has a power which is given to them by means of a commerce clause. So the commerce clause of the Constitution allows for the federal government to exercise powers such as putting a quarantine and putting quarantine for international trade and commerce. And further, there's something called due process clauses of the constitutions. This also provide federal authority into areas of health. Further, we have legislative statutes. So these legislative statutes are written by legislative bodies, and they have powers such as they are responsible for certain governmental regulations such as professional licensures, specific activities such as restaurant inspections, prohibiting activities such as smoking in public places. These are legislative laws. Further, moving on to administrative regulations or law. These are produced by the executive agencies. These are responsible for writing day-to-day operations of government. For example, if we have a legislative statute, and how do we implement those legislative statute of prohibition of smoking? What are the daily operations that are responsible? So that is the administrative regulations. How these services may be provided, who is eligible for these services, and those are the administrative regulations. Moving on to judicial case or law. So these judicial case or common law are laws made by courts when applying constitutional, statutory, or administrative law to specific cases. So that's known as judicial law. Said about police power. So let's apply this police power into a case. So there was a case in 2002, which is Cynthia Boone versus Boozman. So Cynthia Boone was the mother of Ashley Boone. They were the plaintiffs of this case. And Boozman, he was the director of the Arkansas Department of Health. So Ashley Boone was a student in a public school in the state of Arkansas, and they had there was some religious exemption for immunization requirements. So Cynthia Boone challenged the constitutionality of the immunization statute because her daughter was suspended from school because she had not received the required hepatitis B immunization. Now, in opposition, Boozman and developed documents to say that Cynthia Boone or Ashley Boone did not practice some religious belief that was against immunizations. So these are like individual rights that certain people have freedom of religion, and because of the freedom of religion, certain immunizations, or maybe they have the right to not to have that. But Boozman again said that this Cynthia or Ashley Boone did not practice that particular religion that prohibited the immunization, and so it was okay to for the state to act on behalf, and states had the authority over the individual rights, because in order to protect the rights of in order to protect the society from a spread of an infection, everybody needed to have an immunization. So finally the judgment was that the state has the authority, and Supreme Court rules that Cynthia Boone or Ashley Boone, the daughter, has to have her immunization to go back to the state of Arkansas or to the to the school. If she wanted to go back to the school, she had to receive the immunization. So that is an example of an exercising of police power. The state has the authority when to pass the legislation, and so the Supreme Court will allow that protection over the common good. Now next is Interstate Commerce Clause of the US Constitution. So these Interstate Commerce Clause gives right to the federal authorities. So they can how we tax, how to provide quarantine. Now in the case of epidemic, how we quarantine stuff, and so that is a power vested in the federal authority. Further, we said there's individual rights. So there are individual rights for freedom, individual rights to right to privacy, right to treatment, right to refuse treatment. These are protected by the Bill of Rights. So everybody has individual rights. They have the right to privacy, right to refuse treatment, right to treatment. So these are rights that had to be upheld, and that has to be upheld. So what do we mean by health policies? Health policy can be created essentially by any organizations, and the organization can enforce the policy it created. So health policies are a subset of a large arena of public policies, and these policies can be made by governmental and private groups, and also professional societies or commercial trade associations and other governmental organizations. Now let's look at what is health in all policy approach. So health in all policy approach mentions that the private and public entities work towards the common goals to achieve improved health for all while reducing health inequities. So that is known as health in all policies approach, because there is a growing recognition that collaboration is required across various social sectors and social and health or educational sectors in order to successfully achieve the complex health issues, or in order to address these complex health issues, we need to have a collaboration between various sectors of life. So that is known as the health in all policies approach. So what is health in all policies? So health in all policy is an approach where private and public entities work towards the common goal to achieve improved health for all while reducing health inequities. So it is an approach where various sectors collaborate each other, and they take public health decisions and provide for safe environment and thus avoid harmful health impacts and try to improve population health and health equity. So American Public Health Association and World Health Organizations have endorsed and are working to implement health in all policies. So the key to health in all policies is the interaction between health and non-health sectors of government and the society. Let's take an example, like look into this figure and see how air pollution can be tackled by various collaboration between various agencies. In WHO, this pamphlet says that the health and all policies requires different sectors working together. For example, health, transport, housing, work, nutrition, water, or sanitation. So in order to ensure all people have equal opportunities to achieve the highest level of health, we need a collaboration of various sectors in the society. So in order to tackle air pollution, we need to have clean energy, good housing system, urban planning. We need transport and low emission vehicles. We need industries that replace smokestacks. We need to have good, excellent waste management. We need to have local and regional authorities that ensure that taxes, they are highly taxed if there are a lot of pollution, and incentives are given when they practice lesser pollution of air. And the health ministry has to further track the health impact of higher air pollution. Now let's look at how were public health policy priorities established. In the United States, there's an initiative known as Healthy People. So the Healthy People prioritizes the issues that affect the health of the US population. It is a collaborative effort of a multitude of private and public organizations. And they set evidence-based national objectives that are aimed at improving the health of the population. So right now we have Healthy People 2030 available. So there are a large number of specific objectives which are organized into topic areas in Healthy People 2020 or to Healthy People Now 2030. Now let's look at how do philosophies towards the role of the government affect health policies. So one of the fundamental differences within our society is the attitude about the roles that government should play in advancing health. So in order to appreciate this issue, we look at two contrasting philosophies regarding the government's role in healthcare and public health. So one is known as social justice, other is known as the market justice. The social justice approach views the equitable distribution of health as a social responsibility, whereas market justice approach emphasizes individual rather than collective responsibility for health. So the social justice says that we need to distribute health equally and it is a social responsibility, whereas market justice focuses on individual responsibility for health. So let's look at what are the characteristics of market and social justice and what are the implications of these two different philosophies. So there are two philosophies, we said, social justice and market justice. So social justice approach, we said, they view equitable distribution of health as a social responsibility, whereas in market justice approach, we emphasize individual responsibility for health. So in order to understand that, let's look at what are the contrasting characteristics of market justice and social justice. In market justice, they view healthcare as an economic good, whereas in social justice, they view healthcare as a social resource. In market justice philosophy, it assumes free market conditions for health services delivery. Whereas in social justice, they require active governmental involvement in health services delivery. In market justice, it assumes that markets are more efficient in allocating resources equitably. In social justice philosophy, it assumes that government is more efficient in allocating health resources equitably. In market justice, the production and distribution of healthcare are determined by market-based demand, based on the demand or the need base. In social justice, medical resource allocation are determined by central planning. And medical care distribution are based on people's ability to pay in market justice, whereas in social justice philosophy, the ability to pay is inconsequential for receiving medical care. In market justice, access to medical care is viewed as an economic reward for personal effort and achievement. In social justice philosophy, believes that everyone should have equal access to medical services and it is viewed as a basic right. So let's look at what are the implications of market and social justice now. So in the market justice philosophy, every individual is assuming responsibility for their own health. So there's individual responsibility for health in market justice, whereas in social justice, there is a collective responsibility for health. And in market justice, benefits are based on individual purchasing power, whereas in social justice, everyone is entitled to a basic package of services. Like in case of Affordable Care Act, everyone have the right to receive the essential services. In market justice, there's a limited obligation to the collective good, whereas in social justice, there's a strong obligation to the collective good. In market justice, there's emphasis on individual well-being, whereas in social justice, community well-being supersedes that of the individual. In market justice approach, private solutions to social problems, whereas in social justice approach, whereas public solutions to social problems. And in market justice, rationing is based on ability to pay, whereas in social justice, there's a planned rationing of healthcare. So these are the two basic philosophies of how government approach healthcare, or how they develop health policies, if they believe in social justice approach or if they believe in a market justice approach. Now let's look at, is there a right to health care? So there is an international document known as Universal Declaration of Human Rights. This was adopted by the United Nations General Assembly in 1948, and this declaration states that everyone has a right to a standard of living adequate for their health and well-being of himself and his family. And these provides rights such as right for religion, right for freedom, right for health care, right against slavery, right against oppression, and many others. So many developed nations have incorporated a right to health care in their constitution. Even though the term health is not mentioned in the US Constitution, the state constitutions and the US constitutions, a right to health care can be created via our constitution. Or it can also be created in the United States or within a state by the legislative action. But there is something else known as no duty principle. So no duty principle, this was a judgment after the case Hurley versus Eddingfield. So in this case, a licensed physician refused services to a pregnant woman despite being offered prepayment and despite knowing the fact that no other qualified physician was available. As a result, the woman did not receive medical care and both she and her unborn child died. But the court established a no-duty principle, which states that healthcare providers, whether the individuals or institution, do not have an obligation to provide health services. So that is no duty principle. Now there is another law which was passed in 1986 by the federal law. So that is known as Treatment for Emergency Medical Conditions and Women in Labor Act, known as EMTALA Act. So the EMTALA Act represents the only truly universal legal right to health care in this country. So EMTALA, which stands for Emergency Medical Treatment and Active Labor Act, requires hospitals who participate in the Medicare program to provide appropriate screening and treatment to stabilize patients and treat or transfer to a more capable hospital. So this law stopped the process of dumping patients on public hospitals by private institutions to avoid incurring unpaid treatment costs. So I think this is one of the good acts now. It's the EMTALA Act. Now let's look at how does public health balance the rights of individuals with the needs of the societies. We discussed about individual rights, the right to health care, and now let's look at something else known as privilege. So an example is driver's license. Driver's license is considered as a privilege, not a right. So that's why the states have has the authority to regulate rules and regulations regarding driver's license. They provide rules for age, they provide rules for suspension of driver's license, they have rules for what is the age and length of a learning permit and what are the requirements of a driver's license, and they have requirements for vision and hearing tests for older drivers and re-examination for road testing and such. Why? Because motor vehicle injuries remain a major cause of death and disability. And because of that, the states has the responsibility to protect the public. So now the needs of society takes more power than the concerns of the individual. And so it is considered as a privilege and not a right. Further, we'll look at types of risks that are taken. So one is self-imposed risk. Even though an individual knows that his actions might be detrimental, he might knowingly or willingly do that. For example, a person is not wearing a helmet on a motorcycle. He feels that I don't want to wear a helmet. I want to just feel the air in my hair. But you know that how dangerous it is, right? So choosing not to wear a motorcycle helmet while riding a motorcycle is the individual's own risk. That is a self-imposed risk. Another one is imposed risk. That is risk to individuals and populations that is out of their control. So an example is exposure to environmental toxin from a factory. Here, the individual feels that I have the right and desire for clean air, but because of this factory's emission, I do not have a clean air. Now the society has, or the government has, the responsibility to enforce environmental emission regulations. So the focus of responsibility differs depending on whether the risk is self-imposed or imposed, as is the case of quarantine. Many people feel that their rights are being infringed because of quarantine, but the states has a responsibility to keep the society or to protect the spread of this infection. Now let's look at some bioethical principles. So we said that bioethics are ethical principles that provide foundation and direction for complex decisions in healthcare. Okay, in healthcare, there are some principles of bioethics that we use. Those are called beneficence, autonomy, justice, fidelity, non-maleficence, respect, or veracity. So what is beneficence? Beneficence is promoting well-being and doing good. A healthcare provider is promoting good. Whatever practices they do, they are doing trying to promote good. Next is autonomy. It is promoting independence or helping the patient to make an independent decision. That is autonomy. Another principle that is used in healthcare is justice. That is doing what is fair or providing an equal treatment. Fidelity is being true and loyal. Even though we know that is like kind of providing information, even though we know that certain can have side effects, certain medications can have side effects, you tell the patients this can occur. And if the patients, what is the prognosis, you tell that, a healthcare provider tells that. That is known as a principle of fidelity. Further, there's something called non-maleficence, that is doing no harm. A healthcare provider should not cause any harm to the patients. Next is veracity, that is again telling the truth. And respect, that is treating everyone with equal respect. These are some ethical principles that guide healthcare practice. In public health, when you come to public health, what are some ethical practice? These ethical bioethics in healthcare also can be involved in public health as well. So, Public Health Leadership Society has provided some principles known as Code of Ethics for public health practitioners. Let's look at these Code of Ethics. So the public health should address the fundamental causes of disease and requirements for health, and should aim to prevent adverse health outcomes. Public health should achieve community health in a way that respects the rights of individuals in the community. Public health policies, programs, and priorities should be developed and evaluated through processes to ensure an opportunity for input from community members. Public health should advocate and work for the empowerment of disenfranchised community members, aiming to ensure that basic resources and conditions necessary for healthcare are accessible to all. And public health should seek the information needed to implement effective policies and programs that protect and promote health, should do a need assessment. Public health institutions should provide communities with the information they have that is needed for decisions on policies or programs, and should obtain the community's consent for their implementation. Public health institutions should act in a timely manner on the information they have within the resources and mandate given to them by the public. Further, public health programs should incorporate a variety of approaches that anticipate and respect diverse values, beliefs, and cultures in the community. Public health programs and policies should be implemented in a manner that most enhances the physical and social environment, and should protect the confidentiality of information that can bring harm to an individual or community if made public. Public health institutions should ensure the professional competence of their employees. Public health institutions and their employees should engage in collaborations and affiliations in ways that build the public's trust and institutions' effectiveness. So these are some code of ethics for public health practitioners. Now let's look at some bioethical principles to protect individuals who participate in research. Now we have to look at some history. The first is Nuremberg Code. The Nuremberg Code is a set of research ethics principles for human experimentation, created as a result of Nuremberg trials at the end of the Second World War. The Nuremberg Code was formulated in August of 1947 in Nuremberg, Germany, by American judges. They were sitting in the judgment of Nazi doctors accused of conducting murderous and torturous human experiments in the concentration camps. Those experimentations were called the doctor's trial. So the Nuremberg Code served as a blueprint for today's principles that ensure the rights of subjects in the medical research. So the Nuremberg Code includes about 10 principles. One is voluntary human consent is essential, and the experimentation results should result in good for the society, and the anticipated results should justify the experiment. Avoid all unnecessary physical and mental suffering. No experiment if there is any chance of death or disability. Minimize the risk of subjects. Proper preparations and facilities must be there to protect the subjects. Experiments must be conducted only by qualified persons. Subjects or the research participants can withdraw at any time, and terminate experiment if results are known or with best judgment. So these are the principles or the Nuremberg Code. Now let's look at the Tuskegee syphilis study. The Tuskegee syphilis study was a U.S. Public Health Service project. It was a study with a collaboration with the Tuskegee Institute, and it was conducted in 1932, and they began to study to record the natural history of syphilis in the hopes of justifying treatment programs for Black individuals. So this study was known as the Tuskegee study of untreated syphilis in the Negro male. The study initially involved 600 Black men, 399 with syphilis, and 201 who did not have the disease. So the study was conducted without the benefit of the patient's informed consent. The researchers told the men they were being treated for bad blood. So in truth, they did not receive the proper treatment needed to cure their illness. So in exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. Even though it was projected to last 6 months, the study actually went on for about 40 years. So in July 1972, there was a public outcry because one of the members felt that this was not right, and the men were never given adequate treatment for their disease because the penicillin was known as a treatment for choice for syphilis at that time, and the drug was available from 1947, but the researchers did not offer it to the subjects. And they were not treated, and this study was conducted to see the natural progression of syphilis. So it was such a horrible study, and so based on this study as well, the newer ethical principle states that an informed consent must be taken, and there should not be any harm done to the research participants. So these subjects were deprived of the penicillin treatment in order not to interrupt the research. So this Tuskegee syphilis study was the major reason for the creation of the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, which produced something known as Belmont Report. So what is the Belmont Report? The Belmont Report provides 3 basic ethical principles. So first is respect for persons or autonomy. So every individual should have the right to know what they are receiving, and they have the right to have informed consent. Then beneficence. And every person, research participant, has a right to be treated in an ethical manner, and they should be protected from harm. And these studies should do good and do no harm. Third principle was the principle of justice. That is equality. Who ought to receive the benefits of research and bear its burdens? So there should be a fairness in distribution of what is deserved. So now we have institutional review boards. So these institutional review boards help us to review this research proposals, and they look at the informed consent and how we select the samples for our research studies. And the institutional review boards now must approve most of the human research. The institutional review boards ensure that there is an ethical conduct of the research. And they use the framework set forth by the Belmont Report, and they ensure that the risks to subjects are minimized and the informed consent are sought. And if the subjects are vulnerable populations such as children, prisoners, pregnant women, mentally disabled persons, or economically or educationally disadvantaged persons, additional safeguards have been included in the study to protect the rights and welfare of these individuals. Finally, what can be done to respond to a threat of pandemic diseases? So pandemic disease requires a global response, and international health regulations adopted by the WHO is binding on all WHO members and is constantly updated based on each of the pandemics, such as influenza or anthrax attacks or SARS or hurricanes like Katrina or Rita, and further now COVID-19. So these international health regulations given by WHO gives you regulations as how to respond to pandemic diseases. Right now, based on COVID-19, we are responding to the CDC regulations. We are looking at the WHO regulations and also looking at the CDC regulations as how to maintain safety and how to prevent the spread of the diseases. Further, we saw that the states has the authority or the power to isolate and quarantine to protect public health, which is known as the police power. Further, 10th Amendment of the Constitution also gives power to the states for isolation and quarantine. And states are generally responsible for public health matters within the borders. So the state, we have to, as in you are in Indiana, you have to listen to the state rules and regulations regarding quarantine and isolation regarding COVID-19. Thank you so much for listening to chapter 5. Please email me with your questions. Thank you.